Okay, we have just ticked over 1 p.m, so I thought we would get cracking on our free live Q&A for dietitians and nutritionists. Today, we are going to talk all things cramps. So cramping is one of those things that historically I think nutritionists and dietitians have felt presence in and relevance for. However, as we look at the evidence or the lack of evidence, I feel like there's lots to cover here today around where do we actually fit, where does our value lie, and does it lie in cramping or does it lie in the collaborative approach to cramping and what we can do in that way. So to start off with the basics, and if you've got questions as I go here, please pop them in. Cramps are basically that painful, involuntary, that will not shock anyone, muscle contraction. They're really unpredictable. And also it's really low research, right? So we don't have really great understanding of the cramp, but it's also a really tricky thing to research. If you can imagine how unpredictable they are, they're really hard to have testing on, particularly in the lab setting. So the most studies in cramping are actually within like the electrical stimulated cramps rather than the natural onset cramps. So just keep that in mind as we're chatting through that there's lots we still don't know. What I'm going to present to you today is where the research is at, where the theories are at, and what I feel we can do in practice to not only prevent cramps, but also what to consider when we're actually treating cramps as well. I guess the first thing to look at in terms of cramps is what actually causes them. And there's a couple of different theories here. And you've got theory one, which is an electrolyte imbalance, and probably more so that theory than dehydration. It seems to be an electrolyte imbalance is one theory. The second theory is really around that nerve-related muscle contraction or involuntary muscle contraction and looking at the fatigue placement of this and where fatigue fits. If we're looking at that, and I'm going to expand upon that, two theories, and also where we sit as nutritionists and dietitians in a sec. But what actually increases the risk is really relevant to cover first, so that you can kind of work your way backwards to then going, how are we going to prevent this? Or do we need to focus more on this considering the current circumstances of your event or your competition and all those types of things with the athletes you're working with? For the sake of this session, we're going to focus a lot on exercise cramping. So obviously there's different types of cramping in terms of in sleep and all those types of things, but today we're definitely going to go through the exercise ones. For the main reason that that's where most of our care will come from and the discussions, and it felt like the best use of our time in this short amount of time we have in this free Q&A. So let's look at the risk. What increases the risk? It seems to be environmental. So if there is heat or humidity, we will see an increase in risk of cramping. Muscle fatigue seems to be a huge one, and I'll absolutely go through that in more detail in a sec because that's really important that we dig into that a little bit deeper. Poor conditioning, if you're thinking about cramping and when it happens. When I was working at the Brumbies in rugby many moons ago, one thing that we realised is that the cramping seemed to only happen early in the season. And why was that? Because it can't necessarily be an electrolyte imbalance if it's only happening at certain times in the season. And there is absolutely a place for the electrolyte imbalance conversation, which we'll hold, but also there has to be another mechanism at play if it's not just that. So one thing that they did was look at, okay, well, if it's only happening early in the season, then maybe it's a load piece and a conditioning piece. So what kind of things can we look at there? And this is where we see an increased risk of cramping if someone is doing a load or an activity, an exercise, an event that's higher intensity than what their body has trained for, longer duration, or a different modality or technique. So that there's that muscle fatigue piece that we're looking at there when we're looking at the condition of that muscle and the fatigability of that muscle. It also looks like if you're doing an activity that has a shortened muscle, like in terms of, say, the bike fit is really important, the technique in running, those types of things, that increases the risk as well. So the other piece to that isn't in our wheelhouse, but absolutely something that you need to know as a dietitian nutritionist is making sure that we're also considering what surface they are running on, training on, competing on, alongside what equipment they may have changed or used that's different. So, for example, if someone is always training on, in a football context, a hard pitch, moving to a soft pitch might fatigue muscles differently, and vice versa. If you've got shoes and a runner that they've been training on consistently and then they move to race flats, that may fatigue a muscle differently as well, because their technique might change, but also the type of muscle and the muscles they're used to conditioning may then be different in the race setting. So making sure you're actually uncovering all these different factors so that you can then refer on is that big part of discovery when you're working with an athlete that has a history of cramping or is looking to prevent or treat cramps that they might be experiencing. So very much whole of picture that we're going to cover today. So let's look at prevention. Feels like the right thing to now move to. There's extremely limited evidence that depleting electrolytes equals cramping. So we definitely have papers many years ago done in miners mainly, where they did see that when they were working in hot, humid, lots of clothing environments, all the protective gear and also the long hours, by replacing electrolytes or increasing electrolytes, we did see a lowering risk of cramping compared to another mine they were doing that were only drinking water. So that's where a lot of that theory came from around electrolyte replacements and its prevention role in cramping. However, that's pretty much where it sits. We actually do not have, for example, if we're looking at magnesium in the electrolyte setting, we do not have any randomized control trials in the exercise-induced setting to show that it reduces or prevents cramps. Doesn't exist. So there's lots of listening you need to do as practitioners. We need to appreciate the lack of evidence, but also come up with an approach that really considers the pros versus cons in this area. Now, a very small percentage of cramps may actually be electrolyte imbalance. When we look at that, it is probably mainly seen in the ultra endurance events, where it's a little bit slower onset type of cramps, whole of body approach, and less likely to be the shorter duration team sports or sprint events and those types of things as well. So that's just where the theory is sitting. It's, again, really lack of evidence, but just something you need to go in of, like, as a dietitian, you're very unlikely to fix all cramping by giving someone some sodium tablets or some electrolyte drink. It may help with a small percentage in a few where electrolyte imbalance may have been the cause or part of the cause of cramping. But what you need to do instead is think about that muscle fatigability and what is causing that muscle to fatigue, because then you could have a more collaborative, holistic approach to the prevention moving forward from there. So that fatigability is all about collaboration. I can't stress that enough, and I know it's probably like fourth time I've mentioned it in the 10 minutes I've been talking. But when we're looking at the cause of cramps, because it's a fatigue issue, it's not always a nutrition, dietitian realm or wheelhouse. So what you want to consider is when someone comes to you for help with cramping or wanting to see if there's anything to do with hydration and nutrition that they can help with cramping, think about where that cramp is, when it's coming on, how long it's coming on for, if it's the same muscle group each time, and then work backwards from there in considering, okay, well, let's work through what may have caused that muscle to cramp, their preparation, their equipment, the conditions in terms of environment, also the surface that they were racing or competing on, and alongside that, also reviewing their nutrition and hydration. Because when you're looking at the fatigability of a muscle, you do want to ensure that it's well fueled and well hydrated. That doesn't eliminate that. It's just saying that it's a small piece of the puzzle that is cramping. So once you have a cramp in one of your athletes occur, you kind of have to do a bit of detective work and not rush into fix with the one thing that we are great at, but instead gather information first and then work with your physio, your strength and conditioning coach, doctor, and full team in terms of like tech, sports science, and the full high performance team, if you have them handy to you, to really work through where that cause is and which part you have to play in preventing that occurring again. If you're not working really closely in a high performance team, say you've got an individual athlete coming in, the really easy win for you is chatting directly to that person's coach, working through, okay, let's talk about their current loading. What kind of high intensity efforts have they been doing? What's the longest duration of their training they've been doing? And do you feel this is a load issue or something that we can do together in terms of getting them more ready? So, for example, in some aspects, we might see a coach put in more sand running. If we're seeing lots of calf cramps happen in start of season in a team sport, for example, there might be a how do we condition that muscle group better in preparation for the longer duration game, the higher intensity game, or within a hotter human environment of a season, for example. So there's lots of different things that you might chat through and work through with that collaborative team, but really, really important to hold those conversations. So everyone appreciates that this might not be an easy fix. There's definitely some things and opportunities, but it's a whole of team approach. And the athlete needs to be a part of that conversation as well. So once you're kind of working through that source of fatigue, it then allows you to be a little bit more direct in what are my preventative tools now? What tools have I got in my toolbox to be a part of the solution here? And sometimes it's stepping back and going, actually, there is nothing here that I can do, but I do recommend you chat to this person or you'll work on this with that person. And there's a humility in that, and it's completely fine that cramping is not always a nutrition, hydration, electrolyte issue, and that's okay. So once you work through the source of fatigue, you can then direct that. So for example, if it is you work through the source of fatigue and it's like, okay, it was hot and humid, you can go, okay, well, what kind of strategies can I do to reduce the fatigue of the muscle and the body in those conditions? Is there opportunities in pre-cooling, per-cooling, which is during the event, or post-cooling? What kind of things can we do in preparation, training, trial and training to help you achieve those? Is there acclimation or acclimatization strategies we can do to get you ready for that next time? And also, you can do this in preparation for a hot and humid event before cramping even happens. So all of these things you can do in preparation, but also in treatment and prevention for future recurrence. So the other thing you can do is consider, and I've already mentioned this before, is that having well-fueled, glycogen-filled muscles that can go for longer and not reaching and overreaching in that fatigue piece is really important. So carbohydrate availability and like checking on what are they having pre-event, what are they having during their event, and what kind of opportunities do you have there to improve hydration markers, electrolyte intake, and also fuel and carbohydrates over that time period. Sometimes, as I said, you might review and go, you're nailing it. There is nothing else we need to do. But other times you might have some things handy that you might be able to work on. One thing that you might actually see, particularly in those with a history of cramps, is an overconsumption of sodium as well as a real stress strategy where they're actually having so much sodium, they're dehydrating the inner cell. And there's some things that you need to do to try and navigate that in a belief system kind of way as well, which is really, really tricky. But just making sure you're doing a full review and not necessarily thinking or putting forward that more is better in that electrolyte sense, and really listening to the person, their experience, and even working through their injury history can be a really big thing too. Like, for example, in a cyclist, sometimes, if they've got recurrent hamstring cramping, I've had a time where we've tried to do all these things and instead I could have just had the conversation of like, tell me about your injury history in that area. And it became very apparent once I talked to their physio and their team that was actually something that is likely a mechanical piece from injury rather than something I can solve through nutritional hydration. If a cramp actually occurs and you can't, once it's occurring, there's not much you can do. But there is a few things and tools in the toolbox, right, that are available. So one of the easiest, but actually the hardest in elite sport and professional sport in particular, and anyone racing, is to reduce the intensity and pause, rest for a bit. Now, that sounds super easy and might be fine for an age grouper or someone not in a hurry, or someone able to pause, but most of the time that is not actually a relevant tool to be recommending in the elite or professional sports setting. So what do we do instead? Stretching can absolutely be a tool in the toolbox. There's limited evidence. Again, evidence around cramping is very limited, but that can be something that we can pause. In football, that might stop a game for a bit, as an example, or they might sub off, not in football, because once you sub off, you don't come back on, but other team sports, you might sub off, stretch, and go back on. The other piece that is showing promise, and you'll see used very readily in sports now and racing, is pickle juice. I think I've seen and witnessed people use pickle juice quite poorly, and that's from dietitians and nutritionists misunderstanding, I think, where pickle juice lies in terms of the research and the evidence. I want to make it clear that pickle juice, in terms of its electrolyte content, yes, it contains sodium, but having pickle juice at the time of cramps isn't solving the cramp because of the electrolytes in it. It's not about what's in the pickle juice, it's about what it's doing to the neural and nerve pathway. So just remembering that. So there's very limited evidence that pickle juice will help prevent cramps. But if you have an athlete that really swears by it, they've found that it works, then as I said, just weigh up the pros and cons of that. If it's sitting well, it's not going to do harm, and it can be a strategy that might actually help with their mental confidence going into a match or a race. Then just consider that with the individual athlete, but also acknowledge that it's not an evidence-based tool. It's just something that may help. We don't know. At the time of cramp, having pickle juice seems to reduce the severity, which is a win, less damage to that muscle and fatigue on that muscle, but also reduce the duration, which again, if we can get an athlete back on pitch or back in the event sooner with less damage, then that's a real win as well. Just acknowledging that the pickle juice research really only sits in the lab in the electrical stimulus cramp setting. So again, limited evidence, but you will find, and what I've found in the field, is that it does seem to help, and athletes do find that it helps. So I think it's worth, like, when we're weighing up these things of like, okay, I absolutely validate and appreciate that there's low evidence, but what's the risk of not doing it? What's the pros versus cons? And is it a strategy that we'll utilize with the knowledge that sometimes it does actually help? So the mechanism of pickle juice, if it isn't what's in it, what is it? And so it seems to be with the pickle juice that it's a nerve activation. And if you're thinking about the nerve piece of that muscle contraction, that involuntary muscle contraction, it seems to, with that really strong acetic acid presence of pickle juice. So it's really about shocking the nerves and pathway of that. So you can do it with other things other than pickle juice, but pickle juice is the most accessible, easy, cheap. So it's not about the electrolytes. It's actually about interrupting that neural pathway and reducing that cramp and allowing that person to get back into play sooner. So that's definitely something to consider with the treatment of cramps, but not something I'll use as a preventative, but something you can consider if the player or the athlete does feel like it helps them. You can hold that conversation and consider it over the future. As I mentioned with other supplements, like in terms of prevention, magnesium does seem to get a lot of attention in terms of magnesium being used to reduce or prevent cramps. I would say that some people do find that it helps. So the N=1 kind of mentality. We don't have strong, well-published, well-structured studies to say that magnesium is evidence-based in the place of cramping. But again, if it's low risk, if it is possible pro and not many cons, you may put it into a strategy for a player or an athlete that is struggling with cramps. Particularly, it seems with like the sleep, the ones that are happening during sleep. In terms of the ones that are happening in exercise, though, we honestly do not have any RCTs available to us to say that it works or doesn't work. So something that you can just keep up your sleeve as a possibility, but it doesn't seem to hold much evidence as yet. But hopefully over the years, we'll get to a place where we understand cramps a little bit better and really appreciate those different supplements that we might be able to utilize to prevent them or treat them at the time. So please let me know if you've got any questions as I chat through, either if you're live on Insta or on the Zoom. But also, I guess this is a really interesting one where I think our understanding of cramps has changed a lot. I highly recommend reading papers published by Alan McCubbin, who's an Australian researcher and works predominantly in endurance. He has done incredible work in the area of electrolytes and cramping and hydration, and really does challenge different concepts and challenges the bias and belief that can exist in cramping. And I find that his approach is very balanced, well evidenced, and also just a really great discussion point to challenge our ideas or I guess, where we have historically sat as a profession of going, oh, yeah, if someone cramps, myself as a dietitian have a place here in preventing it. Sometimes, absolutely you do, but a lot of the time, if we're actually looking at that fatigue pathway and the fatigability of that muscle, a lot of the time it's actually a strength and conditioning discussion, coaching discussion, sports science, alongside physio massage. So it is definitely a whole of high performance team discussion that needs to happen in terms of cramping, and not just a dietitian. Can you please look at this person's hydration or electrolytes and see if we can reduce cramps? Because yes, that still can be a conversation, but it can't be the whole conversation. In football, for example, sometimes the cramping is actually due to socks being too tight. So that's, the level of digging we do to see what's causing that cramp at that specific site consistently for this player or at a certain minute in terms of the football sense. So really looking at those different things. Depending on the types of athletes and players you're working with as well, you might consider things like the fatigue of that person, the recovery, the adaptations, jet lag, all these types of things leading in so that you can paint a picture for future, but also get to a point where you're preventing cramps as much as possible by the time they hit their key race or key event or key season. So, I hope that has helped. And it's a space that I find really fascinating. I really enjoy the discussions and the challenging of concepts around cramping and just the admission that there's so much we don't know. And so much of this is just an exciting piece forward that we can continue to trial and listen to in terms of the player and the athlete and putting them, front and center as the expert in what they're experiencing. And we can just allow that conversation to be, this is what we currently know. This is what it could be. This is what likely increased your risk of that cramp happening or will increase your risk of that cramp happening at this certain event. So what are we going to do to prevent it or prevent it happening again? And just allowing that conversation to flow in a place where they're owning those discussions and owning those pieces of advice as much as possible. Thanks, team. Now I'm just going to see if there's any questions pop up. None here. Amazing. And I guess, don't overcomplicate things in terms of the pickle juice discussion. When the evidence first started to come out in terms of the lab-based research of pickle juice possibly interrupting and improving cramp outcome, I would be in my rugby team literally buying jars of pickles, straining them. The boys would eat the pickles. I would have the pickle juice for the games, and we would just try and aim for it. The delivery is about the gargle to make sure it gets to the back of the throat ideally. So they don't necessarily need to swallow the pickle juice if that's something that is not sitting well, that they don't tolerate or they don't want to do. But you do need to try and gargle. If you're looking at the player or athlete swallowing the pickle juice, a rough estimate is about 1 ml per kilo. So in a team sport, I'm not going to have everyone have a specific pickle juice. It's a real estimate. We do, as I said, the evidence isn't strong enough for me to really navigate that too heavily. So you might have, anywhere from 60 to 100 ml shots ready to go for the pickle juice for readily available for the players on the sideline, so that those who are running on at the time of cramp, so whoever your support people are, will have them handy. In the endurance setting, you might set up your athletes with a little flask of pickle juice to carry in their pockets and on their bike, particularly if they've got a history of cramping. But they're definitely strategies that you can use either to make your own, or you can buy pickle juice shots or hot shots, which all have that same pathway effect of that nerve activation, so an interruption, if you like. So yeah, something that definitely is a very handy tool in the toolbox that you can use and is very accessible, which is nice, and very cost effective. Awesome. All right. Well, I think if there's no questions coming through, thank you so much for joining us for that live Q&A today. I hope you learned new things about cramps, or at least validated some of your knowledge that you already had anyway. But yeah, please reach out with any other questions, and happy to answer them separately or within the email upcoming with this recording in it. Cheers, guys. Bye. Thanks, Mads. Thanks, guys.